Hi, I'm Teresa McDowell.
I'm Carmen Knudson-Martin.
And I'm Maria Bermudez.
We're co-authors of the text Socioculturally Attuned Family Therapy, Guidelines for Equitable Theory and Practice, published by Routledge. In this clip, we want to share with you a trans-theoretical set of guidelines that help us take these concepts of social equity and diversity and place them into practice regardless of what model that you're using. We'll be sharing 6 guidelines for socioculturally attuned family therapy practice. The acronym that we use is ANVIAT: Attune, Name, Value, Intervene, Envision, and Transform.
So first, therapists need to begin therapy by attuning to the client's context and especially the power dimensions that are often overlooked because they're beneath the surface and yet they shape what client's experience is, and they often shape what the actual problems are that people have brought in or who has been even defined as the problem. It's important for the therapist to not only sort of understand what these contextual issues might be, but to, as much as possible, actually take in, apprehend what it feels like to be in the client's position, to emotionally resonate with how the socio-contextual factors connect to a client's experience. What does it feel like to be a cisgender white man who feels the pressure to perform? What does it feel like to be a trans person of color whose very identity and experience no one else can relate to and for whom there's no language to understand? We also need to attune to and attend to how the power dynamics associated with these contexts are part of all aspects of clients' experience.
The next one we would like to focus on is name injustice. So that would be the N part of ambient. And in the process of naming, we select some experiences or ways of knowing and directly or implicitly link them to possible feelings and actions. In this process of naming, we guide the conversation to name unfair or unjust circumstances and amplify voices of those experiences that are often silenced or marginalized.
Next, we want to value what's been minimized. So we've named, we've attuned, we've named, and now we want to make sure we really value what has been silenced, what's been marginalized, what has not been valued. So strengths, for example, strengths associated with females or with cultures that place less emphasis on individuality and competition and more emphasis on collectivism. Or skills or mindsets needed to survive racism, homophobia, limited economic resources, disabilities, and so on. We also pay attention to how symptoms might be forms of resistance to power and domination.
So another important piece, the intervening part, intervening in power dynamics, is really recognizing how we can use our role as therapists to either unintentionally reinforce the established power dynamics or intervene in ways in which what we do interrupts those power dynamics in some kind of way. So one way that might happen is that we ask questions and develop clinical responses that promote shared responsibility for problems that may have been defined as the responsibility of, for example, just the woman in a heterosexual relationship. And we collaborate with clients to create ways to use the work that we're doing in the clinical session to transform the inequitable power relationships. An important point is that we believe that if the therapists don't take some accountability for intervening in the power dynamics, then the rest of the therapy that we do doesn't really have a chance to sustain itself in the long term because those underlying inequalities, either within the relationship or with our client and in the relationship to the larger society, are still there.
The next guideline is to envision, and we talk about envisioning just alternatives. Oftentimes, people can't envision just alternatives. A lot of times, people feel stuck in their own worldviews that often reflect the dominant culture, the dominant discourse. So, to envision what is possible is an important part of this work. Third order change requires someone or people to envision just alternatives and relational alternatives, to introduce conversations regarding alternatives to the dominant cultural patterns. So, as therapists, if the clients aren't introducing alternatives in the conversation, then we create the space to introduce alternatives in ways that maybe perhaps they just didn't think it was possible. And lastly, this envisioning requires that we be transparent and engage as a participant in the clinical conversation. So the process does feel dialogical.
Finally, we want to help people transform to make what they've imagined a reality. We want to help people engage in third order change, bringing clients back to their equitable goals and highlighting what they're doing to enact their vision. We practice responsive persistence, and we help people build networks that support their ideals and devise strategies that resist dominant social norms.
So in the book, we have chapters for each of the 10 major models of family therapy, and we show how to apply Anviet through that. For example, a attachment-based therapist would be attuning to the circumstances in the larger society that make it harder for some people to feel safe or belonging than others. A structural family therapist might pay attention to how larger patterns of socioeconomic differences and cultural norms are affecting the relationship patterns that we see. And perhaps a Bowen therapist would be aware of the way a person in a lower power position might be paying attention to monitoring their behavior in ways that make a person with more power look as though they're more differentiated. Mm-hmm. So we hope you will dive into the book and read each chapter, and we'd love to hear from you.
Thank you.
Thank you.